Julia, I'm not seeing, oh, here we go. Here, everybody's coming in. So guys, we're just going to sit here and look like lumps on a log for just a couple of seconds while everybody moves into the webinar and just get a chance for everybody to move in there. While you're waiting, we thought, oh yeah, maybe like 1,000 people or so will sign up for this webinar. And it turned out there was several thousand people that signed up for this. So I'm pretty sure not everybody's going to get in, but for those of you who are here, good for you. You showed up early and you got in. And for those of you who couldn't get in, you can't hear me anyway, but there will be recordings, and we'll get some recordings out, not just for you guys, but for whoever wasn't able to be here live tonight. So
good thing I use an alias.
Exactly. So Dr. Marty Goldstein, he gave a similar presentation on cancer a couple years, was that the NCHS last fall, Julia? I think a couple of years ago. And
2014.
In 2014, yeah. And it was one of our most talked about presentations. And the people who went to NCHS that year, the Natural Canine Health Symposium, they were messaging us saying, wow, we went back again and again to that seminar. So we thought it'd be a great idea to bring Dr. Marty back to help everybody better understand what's becoming an epidemic in our canine companion population, and that's cancer. Now, for those of you who don't know who Dr. Marty is, Dr. Martin Goldstein, there's a reason he's a veterinarian to the stars. They know his clinic, Smithridge Veterinary Center, which is just outside of New York City. It's at the forefront of natural cancer treatment. They've pioneered some really progressive and interesting cancer treatments, including cryosurgery, and he's going to touch on this for you tonight as well. Dr. Marty is also the author of The Nature of Animal Healing, which is probably on the bookshelves of a lot of you here. And if it's not, you're going to want to look for that book because it's a great cornerstone for your library. So without further ado, we're going to get Dr. Marty started because I'm sure you didn't come here to hear me talk. So Dr. Marty, are you ready to go?
Ready to go.
Awesome. Let's go.
A little toast to you and your lovely companion animals against this dreadful disease we call cancer. One thing I would like to do is just get the name changed because it instigates so much fear. You hear that word and it's already Doom City. And we do a lot of work with that on the emotional side because of the amazing human-animal bond that exists between you and your companions. So hopefully we'll touch on that later. So we cannot go into denial on this disease. Why such a gruesome topic? Because we see it in our practice every single day, not once a day, not twice a day, 5, 8 times a day. It's just epidemic proportions. So we have to confront this head on. What is cancer? This is just a very brief overview of how I've gotten to see it in the thousands, tens of thousands of cases that I've dealt with over my 44-year career. I don't view cancer as something that exists as an entity or a thing out there that, like a virus or something that lives in the garage that's going to suddenly attack when you're not looking or your pet's not looking. Cancer is grown by the body. It used to be normal cells that, through the lack of proper care of the immune system, starts to grow haywire. So you don't catch cancer. Cancer was normal cells that grow haywire because the immune system is not working properly. Even though that may sound semantical, it's so important when we go to actually treat a patient with cancer. So it's the immune system. I think it's very well accepted right now that cancer is an immune suppressed disease. Another way that I look at cancer, and I know these theories are out there, when we start life, we start as 2 cells, sperm and an egg. They come together, form 1 cell. That cell replicates into 2. 2 become 4, 4 become 8, and on and on and on. And you go through stages of fetal development. One's called a morula, one's called a blastula, where we are probably millions of cells, but they're all the same. And then through the miracle of nature, a differentiation process occurs, and some of these cells become nerves, some of these cells become heart, some of these cells become bone. And all of a sudden we develop into a beautiful individual. Cancer is nothing more than a throwback to that early stage of non-differentiation. The more malignant a tumor is, the less differentiated it is. One of the most highly aggressive cancers is called an undifferentiated sarcoma. And there's not much difference between a bone tumor, which is bone cells that have no proper definition to form a functioning bone, and undifferentiated cells that are going to be becoming bone. So somewhere in there's got to be a link to why we're seeing so much cancer in that triggering mechanism into normal differentiation. Just theories. Incidence of cancer in dogs. Why has it skyrocketed? Why is it now a disease of the young? When I graduated Cornell University in 1973, approximately 1 out of 10 dogs got cancer, and it was always a disease of the old. So if we saw a young dog or even cat in those days and it had a lump, we eliminated the possibility of cancer just based on the youth, the age. Now it's unfortunately become a disease of the young. This is, and I always put this up in my seminars, Betty White's Morris Animal Foundation, 1997, a survey. They reported it in March of 1998. What disease did your dog die from? Look at cancer. Almost 5 to 8 times greater than any other disease in causing death. And this is back almost 20 years ago. That's scary. Look at this beautiful boxer. Liver cancer, chest, abdomen. This is the other side of the postcard that they sent me. Private Buster Keaton, 13 months, 2 weeks old at death. In this picture, he's 8 months old. This is the gruesome picture of the jaw of a German Shepherd named Major. That's the tube for anesthesia. That's a tumor coming out of its jaw. It was first there when the dog was 11 months old. This is a 17-month-old dog from New Jersey. Look, half its entire head is already a tumor, pushing out the teeth, eating through the roof of the mouth. 17 months old. 3-month-old puppy. Excuse me. Just had a little corn. I got a piece of corn in my throat. This is a 13-week-old puppy that's owned by a breeder. Look at that. 75% of the major pad on its back foot is already eaten by cancer. This dog is 3 months old. So we have to wake up against this dread disease. Why is this happening? What are the important factors? What suppresses their immune system? As I said, this is not because more aliens are attacking us from outer space. There is a cause and effect for why we're seeing so much cancer. And since we know that cancer is an immune suppression disease, we have to look at the immune system. What is suppressing the immune systems? So these poor animals, even people, they're no longer taking care of the proper functioning of their body. That's all it is. It's simple. 3 significant influences, there are many. There's chemicals in the environment, there's pesticides. You could go on and on and on. But the way I view it is there's 3 main influences. Number 1, vaccinations. I know I am more or less preaching to the choir. I know you may have heard this before, but it doesn't make a difference. I hear it every single day, and I preach it every single day on all of these 3 influences, because it's vital, because I love animals and so do you. And we don't want to see these 8-month-old dogs already given 3 months to live because of terminal cancer. So vaccinations. It's not that I'm totally against vaccinations. They do have their role in society, but the practice of standardized immunization that we've accepted literally since the 1950s has got to be changed, and there is full scientific documentation. Here is just one of the many studies. This is one of my favorite people in this country, Dr. Ron Schultz, done at the School of Veterinary Medicine in Madison, Wisconsin. Duration of vaccination immunity in a population of dogs. Canine distemper, minimum duration of immunity, 7 to 15 years. Hello? When was your last polio shot? When was your last chickenpox shot? Why are some veterinarians sending reminders out every year that your pet is due for all its vaccines? Bad habit? Time since last vaccination. Immune response called a titer. 13 months after vaccine, that's the level of immunity. 6 years later, it's higher. It's all scientifically proven. We're such a scientifically driven profession. There's your science. So this came out years ago by Dr. Schultz, and I more or less try to follow this as close as possible. We're starting to adopt Dr. Gene Dodge's new recommended protocols, especially because parvo, but because we do have many people that travel many miles to our clinic at Smithridge because they've studied, they've had very bad experiences with vaccines. They are anti-vaccination to the greatest degree they can be. So they want the most minimal program. I like this one. Vaccinate at 12 weeks of age or older with a canine distemper and canine parvo vaccine, then never vaccinate again for the life of the dog, except for rabies. As I said, this has changed somewhat because of the appearance of parvo strain C, but I'm just putting this up there just as an eye-opener that, no, maybe a dog doesn't need 4-in-1, 5-in-1 vaccine at 6 weeks of age, 9 weeks of age, 12 weeks of age, 15 weeks of age, and then 25 weeks of age. That's 25 different vaccines to a 6-pound puppy. Just throwing some, this is more or less, I don't want to go through there, don't focus on the small print, but it's just to make a point. Assessment of the risk of conventional animal vaccines. It's an old paper. It's been tremendously updated. And 10 to 28 days later, that was changed to 7 to 45 days later, a delayed type immunological response. So vaccines are given, everything's cool. And then all of a sudden, 5 weeks later, a tumor grows. Seizures start. Severe allergies set in because there's this delayed type immunological response. Adverse immunological effects of vaccines. Combinations, combining all of these into one different multiple, as Dr. Dodds calls them, combo wombos. It's often viewed as desirable because it's a more potent stimulus to the immune system. However, it can also overwhelm an immunocompromised or even a healthy host, where in nature is anyone exposed to 4 or 5 different diseases at the same time by injection. When you're exposed to the flu, does someone come up and take a needle and inject it into your arm with the flu virus? No, they sneeze on you, and then you have your skin, you have your mucous membranes to protect you. Vaccines are given right into the system. Effects of vaccines on the canine immune system. And this is just up here to show that there is suppressed absolute lymphocyte counts from these vaccines. The lymphocytes are one of the main components of the immune system. Purdue did a study, and in their study, they showed that the body developed autoantibodies to many of their own, many of their own biochemicals. So you give the vaccine and it stimulates the body to recognize itself as foreign. That can't be healthy to the immune system. And here it is. The immune response of dogs with pre-existing allergies has been shown to be augmented by vaccine. It's actually called the allergic breakthrough phenomena. Look it up online. The vaccine stimulates the body to make antibodies against its own cells. All bad for the immune system. One of the big insanities. Vaccination dose with respect to body mass and age. Manufacturers of vaccines recommend using the same dose for animals of all ages and different sizes. However, does that make sense? No. And this is proven across the board. We've taken dogs 50 pounds, 60 pounds. We've given them 1/4 of the dose. We've titrated them 4 years later, and they still have full protection. So we have to work on this. What I learned from Dr. Schultz, I had 2 explanations for why they make the vaccine so strong, and it had to do with the immune system, and overkill is beneficial. And when I had Dr. Schultz on my show, when I had my own show on Sirius Satellite, he actually, when I asked him, why are these doses up to 10 times what the Great Dane needs? And he said shelf life, that they lose their potency in the refrigerator, so the companies make them up to 10 times stronger so they'll last in the refrigerator. My God. So if you happen to bring your pet into a vet when he just bought the vaccines, and your pet weighs 4 pounds, it may be getting 10 times what a Great Dane needs. Excuse me. I know there's science. What about common sense? Okay, definitely preaching to the choir here, but I love preaching to choirs. It's part of my my thing over the years. Created pet food. Purina dog chow. Who created Purina? Probably the biggest selling pet food of all time. Look at that little logo over there. See that logo? Ralston Purina. Back in 1897, the Danforth Corporation started to create this kind of stuff. 1901, changed their name to Ralston Purina. There it is, checkerboard square. Can't beat that. Ooh, wheat cereal. 1902, Ralston adopts the famous checkerboard logo. This is one of the original, we found one of the original advertisements. Hominy grits, barley food, pancake flour, breakfast food. Yes, one of the major throwbacks in the entire pet food industry goes back to the cereal industry. That's right. So we have this beautiful, well advertised, look at the advertising on this. Ingredients: ground yellow corn, chicken byproduct meal, corn gluten meal, whole wheat flour. First time I was on, Martha and Stewart invited me on a show many times when I had a very close affiliation with them. She actually allowed me to say, after presenting labels like this, obviously without titles, Martha, have you ever seen a dog stalk an ear of corn? It's not a natural thing. Rice flour, sorbitol, sugar. This is a bakery. Dogs don't eat bakeries. Cats don't eat at bakeries. And then we have chicken byproduct meal. AFCO definition: consists of the ground rendered clean parts of the carcass of the slaughtered chicken, such as necks, feet, undeveloped eggs, intestine, exclusive of feathers. Yum. Where's the meat? We have carnivores here. Martha allowed me to put this up on her show. Of course, that wasn't there. And this is Science Diet Light, whole grain coal, soybean mill run. That's what's left over in the shells of the soybean. That I think the FDA finally came out against it. But it's been around for a long time. 12%. Chicken byproduct meal, corn gluten meal, soybean meal. She actually let me say on the show, no wonder they lose weight. There's no real food in here for a dog. So I hope you get the picture. Soybean meal run is composed of the soybean hulls. Oh, no. It was there was another ingredient that was taken out. It was corn husks or something like that. But soybean meal run is still in there. It's composed of the soybean hulls and such bean meats that may adhere. So if the dog lucks out and some of the soybean meat actually gets caught to the shell, it winds up in the food. Come on. What about food? This is my definition of science and medicine. Science is man's way of trying to figure out what nature has already accomplished or set forth. I'm really liking a major aspect of medicine right now. The technology of medicine blows me away. The imaging, some of the new ways of treating cancer with focused radiation. I'm not fond of radiation. It's amazing. It's almost like mixing the Apple Corporation and the Microsoft Corporation with medicine. But anything we could possibly do is just trying to figure out, trying to image, trying to find the biochemical pathways of what nature already created. Nature's the healer, not man. Not the vet schools. They're not the healers. So we have to look at science because that's how we're going to get accepted. But we also have to look at the natural tendencies in the body. We've been looking intensely for the cure for cancer for, 60, 70 years? It's always been here. It's called health. Boy, if it wasn't for his tumor, he was in great shape. Bull. You're not in great shape and have a tumor or a heart attack or anything. So we have to watch out about the full application of science to nature because nature's the healing. And you know what they say, if you mess with Mother Nature. How about real food? It's not that I'm promoting any of these foods. This is just some from my old seminar I put up there. Ingredients: antibiotic-free turkey necks and frames, antibiotic-free turkey, organs, broccoli, green beans, yams. Hey, isn't that kind of what they used to eat in nature? Instincts: chicken, turkey, chicken broth, chicken liver. Sounds like food to me. Eggs, peas, carrots, lecithin. You don't see soybean meal run in here or ground corn. Beverages, one of my favorite companies ever. I love this company. Been around since 1935, never had a recall. Beef and chicken, 100% beef and chicken. To balance it, you probably have to mix it with a little bit of maybe vegetation like they did in the wild. But this is what we call food. Duck formula. Grain-free nutrition. I took this picture. I was down at Louisiana State University. They opened their doors to integrative medicine, and I gave a seminar over 3 days. And they actually offered me a position of adjunct faculty just based on a seminar because we're starting to expand in the conventional field our horizon into the benefits of integrative medicine. Then I had a tour of Mike. This is their mascot for their football team. What a magnificent being. And he had the life of Riley. Oh my, I thought he was captive. Oh no, he was like the king of the heap. It was like a $3 million environment he had. Then they went to feed Mike. There's Mike's freezer. I said, funny, that looks familiar. That's our freezer at Smithridge. Kind of look familiar, huh? Oh, we missed a picture of Mike chowing down, but we had that picture. This is a food for cats that they sold billions of dollars of. Ground yellow corn, corn gluten meal, chicken byproduct. The cat is the obligate carnivore. Why are we making, the primary ingredients of their food, corn and corn gluten meal? The pet food industry is now actually taking the responsibility for saying that they created the condition, idiopathic cardiomyopathy in cats, by taking the taurine out of the food. Meat is L-carnitine and taurine. And by making them taurine deficient, they created severe heart disease in the cat. Come on. More good food. Chicken blend, beef blend, turkey blend, lamb blend. This is that. Okay. Unfortunately, probably, I just went through two major aspects of why we're seeing so much cancer. And I think, unfortunately, the number one, not cause, but factor in the creation of cancer is genetics. I showed you a 13-week-old puppy before with 80% of its foot already eaten. And I showed you other dogs, and it's a genetic predisposition. That dog was not vaccinated. It was not eating poorly. By 13 weeks, it had systemic cancer all over its body. Then we have, obviously, our kings of the heap, the retrievers, the boxers, the Bernese Mountain Dogs. That's just as examples. Hold it. All right. We got cancer. Let's see how we're doing at the time. Oh, we're doing great. How do we take care of cancer patients once they get surgery, cryosurgery? Absolutely. Surgery in general does not cure cancer. It removes a symptom. So this whole idea about early detection and early removal can lead to a cure. Bull. Wide margins. Get as much as you can around that cancer. The best thing that surgery can do in a cancer patient is bring the patient back to the point it was at before it grew the first cancer cell. If you don't address the mechanism why the first cancer cell grew, cancer will most likely come back. Chemotherapy and radiation. Not fond of them. chemotherapy and radiation are immune suppressant, powerfully immune suppressant agents. Why are we using things that cause cancer to treat cancer? Because we've messed it up. That is the ultimate sign of how much we've messed it up, that we actually have to take a debilitated patient that has the most horrible disease while still alive called cancer, and then treat it with agents that cause cancer. It's just unsuccessful in the field of healthcare. Alternative therapies, that's our specialty. Diet, we're going to look at all of this. Nutraceuticals, immune, anti-cancer, intravenous vitamin C. Another one of God's gifts to veterinary medicine, Dr. Greg Ogilvie. He was the head of internal medicine and oncology at Colorado State. He was raised by shamans. I lectured at UC Davis with Greg, became very close with him during that. He's just a real, like they say, where I came from in Brooklyn, a real mensch. He actually showed that the byproducts of glucose metabolism, of grain metabolism, glucose and lactate, supply the growth of cancer cells. From that, they started to develop, you hear the cottage cheese, flax oil diet, or ND, the cancer diet. These, once again, scientifically work well, but let's drop science out. Would a dog be eating cottage cheese and flax oil in nature, or a canned food that simulates that? No. How about meat? How about oil, like salmon oil, fish oil, a meat-derived kind of oil? That's my dog, Danny, at the age of 11. He lived till 19 and a half. They say, statistically, 66% of retrievers get cancer right now. I've heard reports up to 80%, maybe even a little higher, of Goldens get cancer. That's what an 11-year-old golden retriever should look like. Yes, he should go to 19. And look at the other thing. Look at that nose. Go around in society right now, especially with retrievers, and you'll see 60, probably 70% of all retrievers are born or develop pink, light brown noses. That, to me, is my own personal theory on this, is just as integrally hooked up to the immune suppression as in all the cancer we're seeing. That's the way a nose should look. Supplements. What are they, or what should they be? Are they needed by our pets, and why? Here is my take on supplements. A supplement, in theory, should be a concentrated food that makes up for the deficiencies that we've given them over the years. Oh, by the way, look at that picture. I didn't even notice that till just now. Look at that picture. That's an immune suppressed dog right there. So back to supplements. It should be a concentrated food to make up the deficiencies that we've adulterated the food chains over the years. So let's say a dog way back in nature, way, way back, ate 80 grams of liver a week. You take a dog right now, born in society, and you feed them 80 grams of liver a week, they probably won't do well because they're so genetically shot. So what we need is a supplement of concentrated liver, 230 milligrams of liver, or 800 milligrams, whatever the number is, that makes up for the deficiencies we've passed on through the domestication process. So are they needed by our pets? Absolutely. I hear so many times, my pet is really healthy. If I put him on really good food, does he really need supplements? Yes, to make up for those deficiencies. So that's the big why. Some of my favorite supplements. Now, I'm not promoting, and there are many. When I started to do integrative medicine back in the early to mid 70s, there were literally no supplements. There was one vitamin made by a drug company. So as I worked on my own health, trying to get that back, I didn't come out of Cornell and say, ooh, I want to be holistic. It didn't exist then. I was just very unhappy with my own health state and state of affairs. I searched. I had to drive 35 miles to the nearest health food store. And when I started to get better from my chronic, genetically based illnesses, it was common sense to try it on our family pets. And when it worked, we started to use human supplements and then transpose them to animals. Now, one of the really good things, but also can be confusing and bad things, is there are a zillion supplements on the market. So, and I don't know probably 90% of them. I wish I did, but I just, with my staff of other doctors, you just have to close your mind to the availability of supplements, because as a practicing clinician, you become confused. So these are some of my favorites. Artemisinin. That's the Chinese herb that was used to treat malaria. The malaria organism loves iron. Where iron is taken up in the malaria organism, artemisinin creates free radical release, kills the malaria organism. A Chinese doctor, Dr. Lau, postulated, well, if it works in malaria, why wouldn't it work in cancer? Because cancer loves irons, and he proved that it was right. My understanding is that the Nobel Prize was awarded last year for artemisinin in the treatment of malaria. So, yay. Poly-MVA. You could look these up online. I don't want to get too much into them. Created by a genius at Stony Brook Medical, Dr. Merrill Garnett. Stops the replication of cancer cells electrically in the cell wall. Apocaps. Love this. Dr. Damien Dressler, now a good buddy of mine from Hawaii. His book, The Dog Cancer Survival Guide. #1 on your list. Co-authored by one of my dear friends. I would actually term her my sister, Dr. Susan Ettinger, who had the oomph to come forth as a conventional board-certified oncologist and co-author a book at Integrative Cancer Care. And Damien created Apocaps. Great supplement. 3 different herbs that is anti-cancer. Fish oil, top of the list on any cancer patient, up to bowel tolerance. The more fish oil your pet will tolerate, the better off. Mushroom supplements, starting to love these. We've used one for many years, created by E. Horbasco out of Hawaii, called Cas Options. I love Pet Fraction. Pet Fraction, it's the Mushroom Wisdom Company. They recently flew in from Japan. They showed me studies of dogs with tumors where the only ingredient added in was their mushroom fractions, and they experienced tumor regression. And then the new mushroom that's getting all the play is the cordyceps. Eye immunity, canine immunity. Cordyceps is now being added into the Pet Fraction. University of Pennsylvania did studies. Imagine that. University of Pennsylvania did studies on treating cancer in dogs with mushrooms, and published it. Yay team, Animal Medical Center, the oncologist there, Dr. Marie Camps, dynamite lady, recommends mushroom supplements for their cancer patients. But there are many, many, many more. My recommendation, because we do have the #1 doctor, on the planet, Dr. Google, could be dangerous. So many people come to our clinic with a stack of supplements, some I never heard of. And I just tell them honestly, if it feels good to you, if the research sounds promising, and it doesn't have side effects, yes, use it, because that's how I learned. All right, let's go and see how to treat these patients. Remember our friend here with the tumor, 13 weeks old? This is the interrelationship of the organs of metabolism of the body. Pituitary, the master gland, sends out signals to the adrenal, stress and inflammation. Thyroid, carburetor. The liver, reticular endothelial system, major component of the immune system. The thymus, kissing cousin to the thyroid, where the immune system is programmed. The other thing our pet food industry did for us, unfortunately, is took all of these out of their diet. So when we do surgery, like cryosurgery, or we see a dog that had a tumor removed, we work on their immune system by taking blood and put them on supplements specific for them. So here we go. There it is. Notice the date. This is a highly aggressive mast cell tumor that was confirmed by the #1 pathologist in the United States, The recommendation by 2 board-certified oncologists was 25 radiation treatments, 5 days a week for 5 weeks, in conjunction with the followed by chemotherapy, because the lymph node in that leg was 3 times normal, and the spleen was enlarged, and the lymph node was confirmed of having cancer cells. The breeder read my book on cryosurgery, came down to visit me. I called the oncologist. He was kind of upset that the dog came to our clinic because we were unqualified to treat a dog of this, a cancer of this severity. And I asked him what his prognosis was, and he said he expects this dog to be dead by January of 2005, but he would not speak to me until then because he only goes by statistics. This is me freezing the tumor with cryosurgery. Didn't cure anything, but it destroyed the cancer. Cryosurgery has many slices of cake in it too. Less invasive, less bleeding, usually requires less sedation, but it's the only form of surgery that is actually immune stimulating. Cancer is alive and growing. When you freeze it and destroy it, it becomes foreign. The body will reject a foreign object. Then we put, based on that slide I showed you before, this dog, the dog was not named Dog, it was named Doc. That's a typo. We put on artemisinin and a bunch of supplements for the mast cell cancer, for his immune system, added other supplements based on his blood. That's 1 week later. 2 weeks later. Ooh, look at that. 5 weeks later. This is 2 weeks after the prognosis of this dog will probably be dead in about 4 to 5 months. Look what's left. Just a little scar. I wrote this in my book. Cancer is the ultimate excuse to get healthy. That's the dog at 7 and a half months of age, 25 pounds heavier than any other dog in the litter. We got to get that nose black. Look at these dogs with retrievers with pink noses. At 7.5 months later, look what's left of that tumor. That's the original tumor, 1 year to the day. It's called healing. It is possible. We went to film this dog for the Martha Stewart show 4 years later, 5 years later. I called the breeder and I said, it's Doc's big day. Martha wants him on the show. The breeder said, unfortunately, I had to adopt Doc to a weightlifter because he ripped my rotator cuff out of my shoulder and destroyed 2 of my stainless steel runs. So, yes, there is hope with cancer. Here's another great case. How are we doing time? Oh, we're doing well. This dog came to our clinic. It was 1.5 years of age, Black Russian Terrier, and it had presented as an ASAP emergency because it had juvenile histiocytic sarcoma. This is diagnosed as by the Animal Medical Center. They started to treat it before it got even worse, histiocytosis. Then it went to one of the largest hospitals on the East Coast, Oradell, and they diagnosed it as neoplastic malignant histiocytic neoplasm, non-responsive to therapy. Came to us, and up to that point, I never saw success with this cancer. Didn't see many of them. We treated this dog with intravenous vitamin C. High levels of vitamin C intravenously has been shown to be selectively or preferentially toxic to cancer cells while being stimulated to normal collagen cells. Makes dogs healthy, destroys cancer. We've been doing it since the 1970s. It's now getting medical approval. Of course, there's a lot of resistance still against it. These are some of the scientific high dose of intravenous ascorbic acid therapy effects, reactive protein levels, and cytokines in the cancer patient. So it's stimulating cells in the immune system against cancer. We put this dog on intravenous vitamin C. Here is our original nutritional blood test that we developed in the Smithridge Veterinary Center. It's now available across the United States, where we break in normal blood cells instead of optimal or normal reference range, and then abnormal, we break it into 5 parameters. We look at those. What's this going back and forth? Get a very sensitive little thing here. And you can see we have some values that are very outside the normal range, some that are inside the normal range but not optimal, and some that are optimal. And from that, we put together a program of these nutraceuticals. All of this goes into one powder. Dimethylglycine, immune supportive, serum oxide dismutase, antioxidant, the thyroid, the adrenal, the lymph, the thymus glandulars, bromelain to help digest cancer cells. This all goes into one powder. So we put these dogs, not only the intravenous vitamin C, but we start supporting the patient as a whole. 2 months later, look how normal the blood values are. These two values were almost off the scale. Dog goes into remission. Then, all of a sudden, dog's doing great, running around, cancer lumps on its neck. It's heavy breathing because it had lumps in its lungs are gone. Dog develops these 2 lumps on its nose, 3. One there, one there, one there. It's like, uh-oh, cancer's back. Oriental philosophy, getting rid of waste. This is maybe 4,000, 3,000 years old. That if disease doesn't migrate, which means travel in the body, as it gets eliminated from the body, then disease can't be cured. Take a heroin addict. You want to cure a heroin addict? Take him off heroin. He detoxifies the heroin. He actually goes through detox. You want to cure cancer? You have to just don't zap the cancer with surgery, chemotherapy, or radiation. You have to detoxify the body of the original disease that caused the cancer in the first place. And here's a progression of how that migrant occurs. And the final stage, mucus may be released abundantly through the nose. Look at that. Is this cancer or is this the body eliminating disease? So we go back on another intravenous vitamin C. That's 1 year later. 18 months later, went from 82 pounds to 117 pounds. And all of a sudden, 7 years later, we have this organ remission, 7 years with terminal cancer. A tree falls on the people's house in New Jersey, destroys the house. They have to move out for 3 months. They have to adopt the dog because where they were staying wouldn't allow pets. And the people come off the supplements. Dog comes back in to my clinic. When they move back into the house, I take blood samples and look, the liver values are really high again. And the dog has a cyst right in the middle of its back. Just so happens to be at the acupuncture point for liver function. And interesting how the body doesn't just arbitrarily grow a lump. So we go back on intravenous vitamin C. Dog responds, is doing great, but the lump continues to grow. So we decide, let's get rid of this cyst. We take the cyst off and biopsy it. Extraskeletal osteosarcoma, bone cancer, probably the most resistant of all cancers to therapy. So we have this dog in remission from a terminal cancer when it's 18 months old. 7 years later, it gets dealt a very poor blow again, bone cancer. We up the supplement program again. We repeat bloods. She lives till 13 years of age. I now present this case to the medical professionals because we have a dog with 2 of the most malignant forms of cancer known that went from 18 months to almost 13.2 years age. That's like getting a child with terminal cancer from 8 to 80. Yes, there is hope with cancer. Astounding case. How are we doing for time? Never forget this. Elsa comes to me, and she has squamous cell carcinoma of the tonsil that spread to its metastasized to the lymph node. Diagnosed in one of the specialty places on Long Island. They say it's out of their hands, and they bring it to a very prominent, one of the best oncologists in the United States, and he confirms the diagnosis. This is the cancer that killed the actor, entertainer Sammy Davis Jr., I think the same year. And he gives a very poor prognosis because this is throat cancer, squamous cell of the tonsil that spread into the lymph system. So he comes to us. This guy was so hopeless, and it took me over a half hour just to break through the veil of hopelessness with cancer so we could treat Elsa. So there is the second confirmation, squamous cell, tonsil, spread through the lymph system. We see this dog at Smithridge Veterinary Center on January of 06, and so she's 6 years old, and we start therapy. Remember, the tumor was removed. We go on some supplements. We do a nutritional analysis, add in a whole bunch of other supplements. The owner becomes a monster. He gets so excited about this. He literally added over 20 of his own supplements in. Started to import organic salmon, filet mignon, treating this dog like the queen of the heap. 3.5 months later, Elsa grows cancer back. We're looking down Elsa's throat. That's the tube for anesthesia. That's the opening into the lungs. There's a recurrence of the cancer in the same spot. So we biopsy it. Now we have triple confirmation of this cancer. I freeze it. That's cryosurgical probe freezing the cancer. Once again, didn't cure anything. We stay on supplements. That's it being frozen right there. She's doing great. 6 months later, I look in her mouth. Uh-oh. Cancer's back in the same spot. No. So we haven't cured anything. We keep on working on our immune system and working on her immune system. She stopped growing cancer. She died 9.5 years later. The reason I put this in here, a documentary is being done on her life. She used to stalk shark off the pier in Long Island. She used to catch fish, dive off the pier, catch fish. Such an amazing dog. Doctor's delicate balance in keeping hope alive. New York Times did an amazing article on when a doctor gives a patient a poor prognosis, it should now be considered malpractice. Because it just stripped. This guy wouldn't even listen to me. He knew his dog was going to die because of the veil of hopelessness that was implanted into him. So we don't give false hope. We give hope. Another article, when doctors steal hope. No, there's nothing wrong with hope when you're dealing with a cancer patient. It's the first step. I actually wrote an article years ago and I entitled it, When Hope Precedes Healing. You can't get the healing until you got hope. This is our clinic, Smithridge Veterinary Center. We are dealing, I have 3 amazing associate doctors. They're not really associates because they're probably equally or as good or better than me. One of the good things is when I give these presentations now to the universities, to the major institutes, to the laboratories, half of the cases I present are their cases. So I can step back and say, this is not my work. No way. This is nature at work, and we're assisting her. This work could be replicated. Any veterinarian in the United States can do it. So this is smithridge.com. We have our Facebook page. Notice how I also have drmarty.com. I didn't put it up here because one major piece of advice is I get many webmails or emails to my website, and it's dogs with really bad cancer asking for advice. If your dog has cancer, don't go on the internet. Go find. There's integrative veterinarians all over the place right now. The American Holistic Veterinary Medical Association has a listing of these. It's a great association. It's okay to go on the internet, research. You know, they say that the internet and Google has increased the IQ of the human race 100 points. I use it all the time. We all do. But don't treat your dog by internet. Get your dog, get your cat in the hands of a well-seasoned integrative veterinarian. So that's why I didn't put Dr. Marty on there, because if your dog or cat has not only cancer, any more severe condition, don't send an email to a website looking for help. So that was one of my big points. And I think we're done. Yeah, do we have any questions? Dan, are you guys there?
Awesome. I'm back. I am back. Thank you, Dr. Marty. Yeah, I actually want to ask a quick question. Just when you're saying, and I get that, right? Because I remember when my boys got cancer. I had my you know what happened? I don't know if I've ever told you this story, but they spread some toxic chemicals around the farm here, and I didn't know. And I had the dogs out, and they were eating the apples off the ground.
Whoa.
Right. So I live on a sod farm. I didn't know. And they came but after they strip the sod, they spray this, I don't know what it is, right? But it kills the sod. It kills everything. So they sprayed in November. By December, Simon was showing signs of a brain tumor, and he was dead by February.
Oh, God.
By that time, Aaron was showing signs, and he was dead in April. Like, they killed both my boys. But so if anybody's there listening, I mean, I know what you went through. I can't tell you how many nights I was up till like 2, 3 in the morning. And what do? You go through the internet, right? And it's mind blowing. And I actually did end up with artemisinin, which was great, but it's absolutely mind blowing what your choices are. And so I agree with you that you should work with an integrative vet. Here where I live in Ontario, I'm gonna sound a little bit facetious, but most of the vets within a 5-hour drive, I wouldn't bring my dead cat to, right? So, and there's some vets that do call themselves integrative. So for those of us that are thinking, great, yeah, we want to go to an integrative vet, but probably as well as I do, there's a lot of integrative vets. There's integrative and there's integrative. So how can people tell the difference?
That's a great question, because you are correct. We did a survey years back over 6 weeks where we took my clients that I saw in 6 weeks. The average client was 590 miles away from my clinic. Yeah. So people will travel, not that you should, and it's just because we have helped literally thousands and thousands of patients over the years by doing phone consults with veterinarians in the loop. So we're acting as a consultant to the veterinarian. But there are some things we do at Smithridge that you just can't do by phone or by internet, like the vitamin C and this and that. One thing I recommend to address your question, go into local health food stores and ask, who do they recommend? Because good veterinarians will over time develop a good reputation. And so people, because some people, when I say integrative, they don't even know, there may be one a mile and a half from their house, and they don't even know the word integrative or holistic. Mm-hmm. So one of the things is look for reputations, and health food stores, like a good health food store, a good community health food store, will tend to be a good place or source of information. And they'll go, oh, go see Dr. Smith and Dr. whatever his name is. He's awesome. Or, oh, don't go to see him. So that's usually what I recommend. But it's very difficult. We have Google ratings right now. Sometimes you can't trust them because a veterinarian will successfully treat 99 out of 100 patients, and one patient where the disease killed the patient, not even the vet, they'll write a bad article, and the only thing you'll see is the one bad article on the vet. So you got to watch out for some of these ratings on the internet for professionals.
Yeah, absolutely. That's true. And it's funny because you touched a little bit on radiation and chemotherapy. And the one thing that baffles me is when you consider all of the probably billions of dollars that have gone into cancer research and even, canine and animal cancer research. And the best that we can come up with, what's still the gold standard, is treatments that they were using in like 1940. right?
Yeah.
It's they're pretty archaic, and you touched upon that, and I think it was Dr. Ian Billinghurst at one of our sessions, and what he said was so smart. It is that a lot of the treatment options for cancer, they only focus on the cancer. They just want to kill the cancer, and they forget that the cancer lives in a dog. And I guess the hope is that they kill the cancer before they kill the dog.
That's their hope. We're a disease-oriented establishment, a profession that's disease-oriented. We do have animals that came to us 5, 6, 7 years ago with tumors in their abdomen. And 6 years later, they're given like 5 months to live. 6 years later, they're running around. They still have tumors in their abdomen. So we've been very unsuccessful in reference to the cancer, but very successful in reference to the patient. It's about the patient. And you're right. You were way off in your statistics. I had the privilege of becoming very close to Dr. Lawrence Burton. I wrote about him in chapter 8 in my book. He's been long deceased. He was a genius in cancer, in human cancer. He had unfortunately leave the United States. He was practicing in Bahamas. But this man was a blithering, his IQ must have been 230, 250. He was so far up there. He told me then, and this is going back 15 years ago, that cancer was a $3.2 trillion a year industry on the earth. Whether he was right or not, I don't know, but I trusted that man because he knew cancer backwards and forwards. So it's not billions, it's trillions.
Yeah.
Scary.
Yeah, I know. I feel so bad because we get a lot of emails. We get a lot of people saying, "Hey, would you like to contribute to the Canine Cancer Fund?" And I'm like, "Yeah, no, unless you're going to talk about, stay away from unnecessary vaccines or even vaccines altogether. Unless you're going to talk about don't feed those crappy foods that you talked about in the beginning. I'm not interested, right? It's just I don't need to be part of that machine."
Yeah, it's true. I don't contribute to those. When I go to the store, and it's just because they're very, very well-meaning organizations, but I just think they're going in the wrong direction. And as I said, some of the new radiation techniques, like stereotactic and the cyberknife, they blow me away. They're like the cyberknife is a General Motors robot that's programmed with an MRI device, and you actually plug that into the radiation unit, and it focuses the radiation beam only on the tumor, and it concentrates it, but it doesn't hurt any of the other tissue. So you're actually destroying the tumor without and what can usually take 12 normal radiation treatments, you can accomplish in one treatment. That blows me away. You're not curing anything, but if we have a dog that's dying because lack of stereotactic radiation, you do the radiation to save their life, to buy you time. You do the surgery to buy you time. If a tumor is pressing into the intestine and food can't pass, you take the tumor out surgically to buy time to then work on the patient. You didn't cure anything by taking that tumor out. Very important factor.
Are there cases where you would look at a tumor and say, that's reasonably slow growing? Would you want to leave it in some cases and use it as an indicator of how the dog is doing?
Exactly right on. Because we have seen a lot of tumor regression, especially if we see a dog that has a tumor inside, or you don't know if it has a tumor inside, and then it has a tumor, small, that's right under the skin. Don't put that dog under surgery and take your little flagpole out. Because if you put this dog in a program and that tumor in the skin starts to shrink down and subside, that tells you that it's working. Also, learning from Burton. Burton really went into the immune system, and he found protein components of the immune system. Tumor complement, tumor antibody, and one that's called a D-blocking protein. And just like if you get exposed to a virus, your body will make antigens against the virus, or antibodies against the virus. There's the same kind of complex with cancer. So when a tumor starts to grow, it releases a substance called tumor complement, which stimulates the production of antibodies. So the tumor, believe it or not, is actually the #1 stimulus to the patient's own immune system. And that's why sometimes removing a tumor, all of a sudden the cancer goes wild because other cancer cells are sitting there. The tumor that's there is stimulating the immune system. You take that tumor out, the stimulus goes away, and all of a sudden the other cancer cells just grow and overwhelm the system. So I don't mind leaving that tumor there.
Awesome. That's
Good point.
fascinating. Dr. Marty, do you have time for just a couple of sidebar questions? Are you?
Absolutely.
Yeah, you're okay. I'm
Oh,
seeing a
yeah.
lot of questions on the sidebar, and we weren't originally going to take them, but there's actually some. Way to go, guys! There's actually a couple of good questions in there, so I wouldn't.
Yeah, way to go.
Those.
And there are some in the Q&A box too, in case you didn't see those.
Don't know where that is, so I'll start with you. But Heather had a really good question, and it's true. She's very interested in Labradors, and lymphomas and leukemia are becoming an increasing issue in those breeds. Are those the type of cancer that you see a reasonable amount of success with, or what do you think?
I wrote this in my book 18 years ago, and it really hasn't changed much. As unfond as I am with the need for chemotherapy, the standard lymphosarcoma is so chemotherapy responsive and not that responsive to just alternatives that in most cases, you're going to need chemotherapy. Lymphosarcoma is a cancer that suddenly overwhelms the whole body, hits all the lymph nodes. That's systemic lymphoma. And your alternatives, you usually don't have enough time. We've tried. I've only seen 2 or 3 reversals of lymphoma without the use of standardized medicine. So that's where you kind of need chemotherapy. The good thing about lymphoma is it's so chemotherapy responsive that you can have a dog with every lymph node in its system up, and you give it a shot of chemotherapy, and 2 days later, all lymph nodes are normal. You didn't cure anything, but you tamped it down into remission to buy you more time. So that's a good question. It is an epidemic, and it's the #1 cancer type that I do not mind the use of chemotherapy.
Okay, I'm glad they asked that question then. Let's open up this can of worms.
I love worms.
Spay neuter. What are your thoughts on what?
Boy.
I know I'm totally putting you on the spot here, but we're only focused on cancer and the effect on cancer. Because I know it's like there's reproductive tumors if you leave them intact, but and I'm not going to put you on the spot.
No, I'll be on the spot. I got my.
Okay.
I mean, fortunately, the knee-jerk reaction that spaying and neutering, especially early spaying and neutering, has no side effects, has been proven to be bull. We know that. UC Davis has backed it up. The lady who I had on as a guest on my show many years ago, Dr. Chris Zink, who is an MD and a veterinarian, has done amazing references and research showing the link between especially early spaying and neutering and many of the diseases, osteosarcoma, hemangiosarcoma, hip dysplasia. It goes on and on. So we have a new paradigm on spaying and neutering. And their cutoff point, because I went to a continuing education conventional seminar, is that you should try to wait till at least a year. In males, we have a condition, like a precancer condition called benign prostatic hyperplasia, where the prostate gets big. If you castrate a dog like that, you should, it shrinks right down. I have heard statistically the incidence of prostate cancer is higher in castrated males than uncastrated. I don't understand that. But the big issue is the study that was done at University of Pennsylvania, where there was a direct correlation between the amount of heats a dog goes through and its ability to develop mammary cancer. Here's my stance on that. I don't think spaying causes cancer, just like I don't think shoveling snow causes heart attacks. If shoveling snow caused heart attacks, I would be dead at least 5,000 times. What causes heart attacks is a diseased, weak heart. Yes, spaying could have, it could, shoveling snow could instigate a heart attack, but that patient probably would have died of a heart attack anyway. So the spayed patient that develops cancer, what are they eating? How often are they getting vaccinated? What other chemicals are in their environment? What are their genetics? So I really are now pushing to hold off spaying and neutering, raise them on proper vaccine schedules, get them on the best diet. We know that raw is the king of the heap, and then all the diets. Get them on supplementation, hold off on the chemicals, and that spay does not have to lead to mammary cancer.
Yeah, I think it was a Vizsla study, because that was quite interesting too, because what they found was the younger the animals were spayed or neutered across the board, the younger they were getting cancers.
Yeah.
Yeah.
I mean, but once again, that's an instigating factor. I don't think it's a causative factor.
Right.
Because the body, after an injury, has the ability to heal and go back into homeostasis if it's taken care of properly. You injure the body, it's a stress factor. That body, if it's healthy, should be able to heal. So my dog, Daniel, I adopted him, my Golden, at the age of 3. He was a stray. He had a small tumor on his arm that I froze. He lived till 19 and a half, and he was castrated when I got him. So, the other thing too, oh yeah, I forgot to say this. I typically ask every one of my clients that comes in, what's the most predictable thing about cancer? Dana, what's the most predictable thing about cancer?
That it's unpredictable?
You got it.
Yes.
Everyone says, well, it's going to kill you. It's going to do this. No, we have some dogs, the one I showed you before, lived 90% of its life past its life expectancy, 90%. So the most predictable thing about cancer is it's 100% unpredictable patient to patient. So even though you use statistics, and some cancers just suck. Some cancers, mast cell cancer, I love treating mast cell cancer. We're very successful with it. Some mast cell cancers are horrible, but I'll treat a mast cell cancer over a bone tumor any day of the week. But still, I've seen mast cell cancer wipe out a dog in 1 week. I've seen dogs with mast cell cancer without surgery live 12 years. So every case is different. But you got the answer right. Good girl.
Yes. All right. Just really, really quickly, could you just give us some parting thoughts on prevention? What can we do today if our dogs don't have cancer? What can we be looking at? Is there anything? I know.
Great question. That's something I forgot, and I'm so glad you brought that up. Here is the highest level. Oh, there's my dogs. They love it too.
No.
Here is the highest level that we could bring this to. Don't focus on cancer. When I go through supplements, and people will say, would you take that supplement to prevent cancer? There is a very high relationship in the extra-physical plane between dogs and people, cats and people, the animal kingdom and people. If I took an infrared picture of you and your companion animal, I wouldn't see two physical bodies. I see two overlapping fields in the energy plane. You could take infrared pictures. They call it the aura, whatever hocus pocus name you want to add to it. And when you start to do things for cancer on a higher level, you're starting in your being to give cancer a place to exist. So when people say, what do? I stay healthy. I don't take something to prevent cancer. What man fears, he brings into actuality. So if a person comes in with their dog because they lost their other dog from cancer, I try to get that word out of their environment, out of their life, out of their vocabulary. We're not going to work to prevent this new dog from getting cancer. we're going to work on your dog's health. Like I said before, oh, if it wasn't for his tumor, he was in great shape. No, the cure for cancer is health. Don't go past. You're not going to find it in a test tube. You're not going to find it in a laboratory. The cure for cancer is health. The number one focus on any cancer patient, whether you're doing surgery, chemotherapy, radiation, I don't care what you're doing, is you also have to focus primarily on their health in conjunction. Great question.
Perfect. That ties into one of my favorite sayings, where intentions go, energy flows.
Exactly. And that's my whole next book, the higher level of the relationship between us and our companions.
Excellent. Well, there's something for us to look forward to.
Yeah.
Dr. Marty, thank you so much for coming out late on a Tuesday night. Judging by the comments, I think it was very informative to everybody. Thanks so much for coming out. It was very awesome.
It's always a pleasure with your great group from the maple syrup country world.
The maple syrup country.
Yeah.
Awesome.
All right.
Thanks,
Everyone out there, thanks for attending, and yours in good health. Take care.
Cheers. Thanks,
Thanks,
Dr. Marty.
everybody. Have a good night.